make it. This is the seventh in our series, looking at all the aspects of talking to local doctors and health professionals on how we're dealing with this COVID pandemic and the different stories and answering your questions. And it's going to be a great program. This is our last one, but it's certainly going to be a very, very interesting one. Again, welcome. My name is Patrick Canty, and I'm the moderator. I have the good fortune of being the moderator of this discussion tonight. During my day job, I happen to be the publisher of the Odessa American. So we're joined tonight. Tonight is really neat because we've talked to doctors, we've talked to nurses and therapists and the like. And tonight we're going to visit with 5 doctors who are doing their residency for the Texas Tech Health Sciences Centers. These are young doctors, kind of where the rubber's hitting the road, where they're taking what they've learned and they're putting it to practice. And I want to introduce them right off the bat. And first, it gives me great pleasure to introduce Dr. Joshua Ronan. And Josh is a PGY3 internal medicine resident at the Health Sciences Center in the Permian Basin. And I have to emphasize this because he does in his bio, it's his last year. So, with an exclamation mark, right, Josh? Yeah. Josh is originally from the Silicon Valley in Northern California, and he's an aspiring cardiologist. And what he values most about his internal medicine training in the Midland, Odessa area, more so during the COVID-19 pandemic, is a plethora of experience in critical care medicine he's been able to receive. So welcome tonight, Josh. Second, we have Dr. Myra Ahmed. Dr. Ahmed is a PGY3 Department of Family and Community Medicine resident at the Health Sciences Center as well. She graduated from the University of Science and Technology in Islamabad, Pakistan in 2013. And from 2014 to 2017, she worked in clinical research in organizations such as Baylor, Memorial Hermann, and the Cleveland Clinic. Now, here at Texas Tech University, she's been actively involved in clinical research all throughout the residency program that she's been participating in. And she's had the honor to represent the school and her program at multiple national and state level conferences. She's also been co-chairing the resident section scientific committee for 2 years now. Now, currently, she's in a phase 3 clinical trial with the Clinical Research Institute at Texas Tech. And being part of the family medicine department here in the Permian Basin, she's been helping them spearhead the fight against COVID-19, both on an outpatient and an inpatient basis. So she's really proud of that, and we're really proud to have you here tonight.
Thank you.
Moving along, we have a local guy, Dr. Chirig Alur. Dr. Alur is in his 3rd year at family medicine residency at Texas Tech here in the Permian Basin. Currently, you're born and raised in Midland, graduated from Midland Lee, but you are living in Odessa now while you're doing your residency. He's very glad to be a part of the West Texas community, and he continues to hope to provide care here. His goal is to become a clinician and to continue to educate, treat, and care for his patients. And I think we just found out tonight that your next stop is going to be headed to Denver, correct, Doctor?
That's correct.
Congratulations, that's wonderful.
Appreciate it.
Next, we have Dr. Claudia Kelso. Dr. Kelso is in her 2nd year in internal medicine residency at the Health Sciences Center. She completed medical school in Colombia, South America, and has a master's in public health at the University of Alabama in Birmingham. Before her residency, she practiced in Colombia and worked in medical education as the dean of 2 medical schools there, as well as she's helping to lead multiple health interventions in her country. Her career goal is to get back into clinical practice and continue to train and work in medical education and healthcare leadership. Welcome tonight, Claudia. We're glad you're here.
Very much. Thank you so much.
And last but certainly not least, we have Dr. Neha Panchangala. She's a 2nd year internal medicine resident at the Texas Tech Health Sciences Center. She's originally from Hyderabad, India. I say that all the time, and then when I have to say it in front of hundreds and thousands of people, I mess it up. But anyway, you're a graduate there. You went to medical school, medical college in Pondicherry, India. Her career goal is to strengthen healthcare practices throughout education and research. So glad you're here tonight as well. What I'd like to do to get this started is kind of toss it to you, Josh, because this was kind of your brainchild. We've been hearing from doctors and others throughout this thing, but we really hadn't had the chance to hear from residents. So why don't you kind of give us kind of tee this up for what you thought would be good to have this?
First of all, I just wanted to thank you, Pat, and Mr. Shakamuri and Dr. Anand Reddy, who helped us organize this. Ever since moving here from California, I felt the Texas Tech Health Sciences Center was really part of the heartbeat of West Texas here. And I felt like it would be great to come full circle and contribute to the conversation as residents who work hand in hand with the attending physicians whom our audience has seen in previous episodes. So I think this is a great platform for us to share our experience and our thoughts. Yeah.
Well, I can't thank you enough for doing this, because I think, most people see medical students and residents as being so busy and kind of going through their training and getting ready to go on to their practice. And, they're so focused on having to do the day in and day out. And it's a grinding schedule that you think, well, maybe they don't have time to be as engaged in their community, but you certainly do. And this is a perfect example of that. So I can't thank you enough for doing this, Josh, and the rest of you for doing this, and as well to Ravi, Shakamuri, and Star Care for making this happen. I guess to get things started, what I've kind of asked this in previous sessions, to kind of, let's go around the table and kind of describe kind of what your day is like, during this pandemic, and juxtaposed to, if you can remember way back when, what it was like before the pandemic as a resident. Why don't we start with you, Mara?
So I remember when the pandemic initially, when it started back in March, when it hit, and when it actually hit us, our leadership here in the department, we were seeing, dwindling numbers. There were patients in the waiting room, waiting to be, seen, but they had symptoms, and we were like, okay, we need some kind of triage system. And I remember this was mid of March, and we set up a triage system within days here at Texas Tech Clinic in Odessa. And afterwards, that same protocol was adapted across town in multiple outpatient facilities. And also at Medical Center Hospital, our team became the first at the hospital to manage the patients for COVID on the floor. So that's what the beginning was. Initially, of course, the numbers, we didn't have testing kits. So it started off with us seeing a lot of patients under investigation, or patients who were, suspicious of having COVID. To progressively, we were starting to see more and more, testing being available. So more COVID positives were coming up, and then protocols changing ever so often. So it kind of progressed. This whole pandemic has been kind of a ongoing thing for us, but we're still staying strong. I think as a team, we've worked really well throughout this entire, year almost. And then our department has worked very, I think, rigorously throughout for the outpatient respiratory clinic and inpatient on a COVID floor as well. And I'm lucky to be, part of this great team.
What about you, Josh? How's things changed for your routine?
I think we can say for our audience, all of us here, all of us residents have actually worked directly together on a single shift. So we have that rapport with each other, and it's actually quite fun to have this conversation together now for everyone. But, in a lot of ways, I feel like things have been similar in the sense where, I just got off of an ICU rotation in Midland Memorial Hospital. It was very busy, but my days start at 4 or 5 in the morning. And, you get to the hospital, we check the data for our patients, look at the lab results, and go see them and do, detailed physical exams on COVID and non-COVID patients, and sit down with our attending physicians to talk about recent data and what we can do to help our patients. I think for me personally, what has changed from a routine standpoint beyond that is just hygiene in the hospital, doing what I can for myself and encouraging my team members, to always sanitize their hands, wear their masks, and always double check when we go and see patients to be able to ensure our safety. I used to be an EMT back in the day, and the first thing that I learned was scene safety. If you are not protected yourself, you can't help other people. So that's the first step of our care, is just making sure the scene is safe, quote unquote, in that regard, and then jumping in and helping our patients to the best of our ability.
That's great. What about you, Claudia?
Oh, my whole life has changed. So I think we have all experienced differences in our personal life, academic life, work life. It's completely different than it used to be about a year ago. So, for instance, I have a family, I have 2 children, and I have dogs. To me, it's a completely different routine to come home now, and I have a special disinfection routine. I don't touch anybody. I can't touch my children. I can't touch my pets. Um, I have to literally change my clothes when I come in, disinfect myself, go take a shower before I touch anything in the house. And I've been doing that for about a year now. Even my kids, and I'm pretty sure that everybody that is listening has made some changes in their personal life and their personal routine. My children come from school and they also go straight to take a shower and disinfect themselves because we don't know what they have touched. So I think things like that have changed your personal routine is difficult. Academically, we live, breathe, and sleep COVID. So everything we've been doing for the last year is COVID.
COVID.
All
Yeah.
the papers we read are about COVID. The million public, I think it's unprecedented in the history of medical evidence. How many papers have been published in the last year?
Yes.
And all of that, we're always like, who comes up with the newest paper and that is actually high quality enough so we can actually use it.
Right.
So academically, we're breathing COVID, sleeping COVID, studying COVID. Because of that, we were just talking about it yesterday with in our kind of pre-round of this conversation. We have had to postpone our elective rotations that make us a little bit more comprehensive. The training is more comprehensive because everything is now about COVID. You know, so when we're not in an active rotation seeing the COVID patients, we're covering our classmates that are either extremely tired or sick, or something's happened, or we just had too many patients and we have to go and support that. So work-wise, that has changed. Health-wise, many of our classmates, I have been very fortunate so far and I have not gotten the disease, but many of my classmates have had, and it's very difficult. I just got vaccinated, which again, I think every time that you allow me to speak tonight, I'm gonna say, please get vaccinated, please get vaccinated. So I'm gonna repeat that every time that you ask me to say something. I'm gonna find the connection because getting vaccinated whenever it's available for everybody is very important. So I guess, you know, what I'm trying to say, it has changed our lives, and I would just invite everybody that is listening to contribute, to help each other.
Right.
Help your healthcare personnel that is exhausting their strength, doing the best they can in the hospitals. Watch your families, use your masks and get vaccinated, get your elderly loved ones vaccinated as soon as possible, because those are the ones that are going to be able to get vaccinated soon, and just kind of things like that. So we can go back to our normal. This is not the new. We don't want this new normal.
Right.
I want my normal. So that's kind of what I hope for.
Super. Now, what about you, Amy?
Okay, to answer your question, I think I'm going to talk about what I missed the most.
Okay.
As an intern, when I started off on the floors, we'd have something called morning report, and it happens in all residency programs across the country. So it's that time, that 1 hour of time in the morning where we go to that room, have interaction with our attending physicians, we talk about interesting cases on the wards, and then what we do about it. I think that's our only place where, you know, it's like breakfast and discussion, and that's what it is about. I miss that the most, that rush in the morning to finish up everything before 8 o'clock and be in that room, and then, you know, sometimes not get kicked out of morning report if you're late. That's something I think it's a great start to the day, you know, just that Congress helps us decide how our day goes. that I miss a lot during the COVID pandemic, because now it's all about, like Josh, Claudia, and Maida have said, it's about gowning. It's about making sure the scene is safe. It's more about, okay, we need to make sure that we go see them. It's been a few hours that someone has checked on them, so let's go do that. So it's more of a military drill,
Right.
than the fun part of it. Yeah.
Okay. And I guess it's the loss of the personal side of it, because I think y'all talked about, you love being able to see each other, and now y'all joked about how, you just see each other behind a mask, and you really can't interact so much with the others, and it's got to be frustrating. What about you, Cherry?
I'll say that, with COVID now, what's changed the most is, obviously the time that we spend with families. That's one of the biggest things, I think. Previously we had visitors come into the hospital, they could see their loved ones. And as Claudia has mentioned in the past, it's part of the healing process. And I think that's very important. So now with COVID, obviously that's changed, and it's made a big difference. And it prevents, patients from getting that exposure to their families. So now we're in constant communication with the families through the phone, through FaceTime, and I think that gives them some comfort. That gives them the ability to feel like there's still someone who cares for me. And at the same time, we also want to communicate with the family as to what's going on, because they're left in the dark.
Right.
I think that's one of the big things, and that I noticed that we've changed. And the other big thing, as Josh also mentioned, is that teamwork is huge now. We work with the nursing staff because they're our eyes. They're going in constantly, seeing the patients. We're working with other departments. So I'm with family medicine, as with Dr. Ahmed, and we constantly work with internal medicine, working with the critical care team. And then not to mention the pulmonary respiratory team as well. They're always constantly on the floors. So these aspects, as working with teams, was there before, but now, we heavily rely on each other more so than ever. And I think that's important, and we'll continue to do that.
Another thing that strikes me, and we talked about this earlier, I think you mentioned it, Claudia, the interesting thing that y'all bring to the table is the fact that you are residents. You do these rotations. So you'll work in a clinical setting, and then you'll work in an ICU setting. And so y'all have actually had an opportunity to see COVID in the whole, kind of the full gamut of how it affects people from a clinical standpoint. Talk some about that, Claudia, and the rest of y'all.
I think being a resident is a great opportunity to practice medicine with a full spectrum of what medicine is like in real life, in all the different settings. So as a resident, you have to go through, part of your training means that you go through seeing patients in the outpatient setting, which is like a regular clinic, when everybody goes to a primary care doctor, when you go to get your medicines or just a regular checkup, that's the primary care setting. We're there. And then if you get sick, but not so sick, but you still need to be in the hospital for a few days, so you go and you get hospitalized, that's inpatient. So we are there too. And then if you're super sick, then you end up in the ICU, which is the intensive care unit or the critical care unit. We're also there, but in different moments in time. And then of course we do part of these rotations we do all the same during the night as well. So there's no better word for us than a resident, because we literally reside in the hospital. We live there. And we see it all. We're there all day. We're the eyes and ears of our attendings. We're the eyes and ears of our families. So just like Shirak said earlier, we're not only there doing our job and learning and training, but one important thing that I would like to share with everybody that is listening tonight is that just use us where we are, your eyes and ears. We're there with your loved ones, and we love them just as much as you love them, because we're there all the time. We feel your pain, and we're always there doing things to try to make them better. And we try, we do have a lot of patience, and maybe we can't spend a lot of time on the phone talking to our families, but we do try to bring you a little bit of of what we're seeing, what's happening with your relative, with your loved one. The healthcare personnel, everybody else is doing such an amazing job. You have no idea. All the nurses, even the nurses that we had to bring from other cities like New York, they're helping. Everybody's incredible. Everybody's so committed. And we just see it there, like hand in hand, we're working for that. So that's the difference of a resident. The resident lives in the hospital, is there with your patient, with your loved one all the time, almost 24 hours a day. You know, when, for example, Josh has mentioned that when we're in ICU, we easily start our day at 4 o'clock in the morning. And we leave at 8 or 9. We sleep like 4 or 5 hours a day. But we're ready. We do it for a month or even more than that, and we're ready. So whenever we have these conversations, you know, sit here and we're relaxed, this is such a treat. So thank you for this.
Yeah.
So here's a question. We have Dr. Jairam Naidu. He sent in a couple of questions. He'd like to know if y'all feel burnout, and do you feel attending hierarchy during the stressful pandemic? Can you talk some about that?
So one thing that we do a lot of, I mean, between internal medicine, family medicine, is we do a lot of ICU. I feel like the residents that come out of our program, they're very well trained in how to care for critically ill patients. And I've sort of been scanning the chat as well with the comments. And one thing that I like to say is, like, we do have ICU attending access, I mean, completely during the day and also at night. We have actually emergency department critical care specialists that are supporting our ICU at night if we need assistance, and our attendings are right there with us if we need them. I don't think there's much of a hierarchy at all, to be honest. For those of us that were lucky enough to be able to get, I mean, all of us at this point had at least 1 year of experience in the ICU before COVID hit, to be able to understand critical illness and the different ways that it can present, from the brain to the heart to the lungs to the kidneys to the intestines, and be able to treat it. And then you introduce COVID, and COVID really plays everywhere, but the main place that we're living is in the lungs. So it has been an exercise for us with our ICU attendings on lung physiology and how to understand the lungs better. A lot of us may have not liked this subject, particularly in medical school. I know me personally, I was like, sort of like, okay, immunology, virology. But I think this particular time has been a great exercise in learning more and being encouraged to read and learn more because of how rapidly information science has been releasing data, research, for us to be able to apply it for our patients. In fact, just last week, I was sitting with my ICU attending who was waiting on a trial for a particular medication called Actemra or tocilizumab, which is used in the severe COVID-19 patients as soon as they hit the ICU. And we saw positive results from that trial. Our attending is on top of it all. And he's like, I'm ready to use this on my patients. And that's truly remarkable. This is a medication that we started using early, and I spoke with him and he's like, Josh, I'm ready to use this on our patients. And let me tell you, it started to work. But we don't know for sure until we have a big population of data to look at. All we want is positive outcomes for our patients and things to help. As far as the whole burnout situation, I mean, obviously that's a big topic, a very loaded one. But what I like to say is, as a whole, Texas Tech has done a good job in our program at the Permian Basin for all the departments, all the residents, really caring for our well-being in terms of bringing us, snacks and juices and drinks and setting up lunches and coming out of little meetings where we can come and grab a coffee and go. The little things that we can do right now while we're separated and we can't really see each other. A lot of us may not, by the way. I think before we had our little session yesterday, a lot of us hadn't seen each other's faces for a very long time. So it's certainly nice to be able to see people, even if it's for 5 minutes. So Texas Tech has been taking good care of us in that regard as well.
And I agree with Josh completely about how the burnout's been taken care of. But yeah, I think it is essential to acknowledge the burnout as well. It's been there on a couple of levels. It's there on a physical level, it's there on an emotional level. And it's just that everyone got it. When the pandemic started, there were things where people said, by the end of 2020, everyone is going to know someone who actually had the COVID-19. And it turned out to be true. You know, we just let it go. We didn't give it, we took it for granted. And on one side, we were tending to patients, and then there was another side where our own classmates were getting it, like Claudia had said earlier. And the burnout was not from the fact that they just got the disease, but to be there right next to them, 4 miles away, and not being able to do anything.
Right.
Like I did say earlier, right? So it was like I would just drop off food or medications, or if they needed gel packs, and then I just drop it out at their door like a delivery service. And that's how far care could be expressed. And on the other side, I have a personal story myself where I lost my father to the pandemic in August 2020. And so every day I went back to the hospital after it, I was reliving the whole thing. But as days passed by, I realized that I was not acknowledging the burnout anymore, because I'm here with somebody when their family is not there with them. And
Right.
it turned out into a blessing. There was someone with my father when I was not there with him, trying to tend to him, trying to take care of him. So all in all, the burnout disappeared because those small miracles, these drugs, keeping on top of everything, trying to
Right.
make that one person survive. I think that just was the magic wand for us, for the whole burnout to disappear. And again, Texas Tech did a great job in keeping us all together, acknowledging that we do get burnt out, giving us more personnel as backup, pulling us off. Yeah, elective time, we did lose elective time, but it is a great time for us to just recoup and get back to work. And again, family medicine and internal medicine, we've been working so great. And I think if COVID has taught us anything, it's teamwork. And we'd love to, continue that spirit moving forward, even after the pandemic's over.
If I could answer that question just in one quick different
Sure.
perspective, I would call it situational burnout is what I would call it. As you know, Neha was just mentioning, they in residency they rotate us every month through different rotations, and the whole point is that you don't go through burnout. But when you're in the hospital, when you're dealing with COVID, we most definitely feel the burnout. It is, we put on a brave face, and we tell the patients everything we can, inform the family, but it's we have a lot of responsibilities that we need to take care of as residents in order to take care of these patients. Just as an example, there's 5, maybe 6 residents on any given shift in family medicine to take care of COVID patients. And in that situation, we're dealing with at 48 patients. So you divide those 48 patients, you're working with your attendings, you're checking labs, you're checking to make sure what updates are going on with the patients that day. Not to mention updating family, working with the nursing staff. There's so many things that go on. So that definitely plays a huge part in our burnout. But like I said, it's situational. When you come out of treating COVID patients, then you go back to normalcy.
Right.
And absolutely, one more thing I would like to pitch in for what Chirag said is that not just that, like I said before, when we started off, there was one patient in Midland County, and then it came to Ector County from a breakout from a family, and that patient was there in ORMC, and then overnight I went back to my shift at 4 hours later, and then we had a patient, and at that time it was just excitement that okay, we're getting it, but we're going to take care of them, and bam, 2 weeks later we couldn't tell apart patients. We were treating numbers. We were feeling bad about it, and I feel like, like care depersonalization, like we've had in the prior conversation, it's just like you feel like a mother who cannot tell apart her twins. It feels like that because we want to take care of every patient. We want to have that tailor-made treatment for them. We want to make sure that they go back home to their loved ones in a better shape. So that contributes to that situational burnout Chirag was talking about. But again, we're on the field, we put up a brave face, we work towards it as much as we can.
I want to add something. I think part of the question also was what's the response of our attendings, ICU attendings for specialists in the hospital? How much support do we get? And I would say that I personally feel very blessed to be training. I'm Texas Tech proud, and I'm Texas proud. I think we are in a great training center. Whatever we need, we have. and our attendings are exceptional. Not for nothing, most of my internal medicine colleagues and classmates want to become critical care specialists because we have exceptional ICU specialists. We have exceptional subspecialties, and they are easy to reach. You just pick up the phone and call them, or even text them, and they're easily right there for you, weekends and nights. We especially appreciate those that explain things to us and, have patience with us. We're residents, we're still in a learning process and a learning curve, and sometimes we make mistakes, and sometimes we don't give a great presentation when we make a phone call because we get nervous. But, all in all, the other person on the other end of the line that it's willing to take, 2 more minutes of their time and explain why things are happening, and but they're easy to reach. So the appreciation that I feel when I'm in one of those rotations, that I have so much responsibility, so many people that I'm responsible for. I was recently in an COVID ICU, and it had never been seen that just the COVID ICU or the critical care unit had 36 intubated patients at some point. And that was my first week of ICU, yay. So that was very hard. Nobody knew what to do. We were diverting patients to different floors. And the ICU attendings showed up as reinforcements. There were more nurses. There were people just ready to work, and that made our job easy. So yes, we were tired. Yes, we were exhausted. Yes, we had signs of burnout, but that kind of comes and goes if you know that you are well backed up, and we are. I feel in Texas Tech and the personnel from MCH and MMH do really provide enough support for us residents.
I guess what amazes me about y'all's predicament is I know for a fact, because I had friends at a residence, that a residency program is exhausting work, just in normal times, and you're going through your practicums now in a time when the systems are being overwhelmed, and so many, I've talked to doctors that have been in the business for 40 years and they've never seen something like this. And here y'all are, in what's already normally a stressful time, going through something that is just, incredible. And I guess it's you're learning some things about yourself. Maybe talk some about that. What have you learned that you're stronger than you, or that you have more compassion, that you're able to take more? How's this changed you personally?
I feel like for me in particular, and I feel like a lot of us can boil it down to this, is stopping for a second and really acknowledging the fact for patients that are the most critically ill, that it's beyond medicine at some point. It's more humanism than it is medicine. Being able to sit and talk to families, for the community that's watching, the people that you see here, the residents. I mean, we've all worked together, but we are the ones day and night that are seeing the patients in the emergency department, admitting them to the floor, the ICU, and particularly maybe potentially even the first ones calling the families to update them as far as what's going on in their status coming in the hospital. And that's when we sort of switch the medicine off and we turn the human on again. And it's very easy to lose that because we see so many of these patients and we want to treat each and every one of them as unique. And truly, we don't know the patients as well as the families know the patients. When I first encounter a patient's family, the first thing that I say is, I don't know them as well as you do. Please tell me what they're like, and the most difficult part of it is having the conversation regarding, what's going to happen on the ventilator, what we can expect based off of outcomes that, we've studied so far. And it is dire, it's tough to have those conversations for sure. But I think one big thing that COVID has brought to me and really emphasized to me is something that I've always tried and keep anyways, but is that human aspect of medicine. At the end of the day, families can't come in the hospital to see their loved ones. And they used to be able to do that. We all saw that, they'd be able to come in and out, not just when patients were terminally ill, but anytime to provide that additional support. Frankly, part of the healing process is having the family there. There's this concept called ICU delirium, and that's because of all the medications we have to use to keep patients calm while they're intubated on life support. But as soon as we liberate them from the ventilator and the life support, we try and wake them up, do physical therapy, get them a diet, and try and get them up to the medical floor. And part of that process is also getting them back to someone who knows them and they know their voice, so they can help them get up and get going, Pat.
Right.
So that's certainly something that we're missing now. But whenever we have a chance to contact the family, that's when we take a breath, step back from the medicine for a second, and appreciate the human aspect of medicine again.
I think I agree with Josh, and absolutely. One more thing I think that has changed during the COVID-19 pandemic and that I've realized is how strong the community is. They came together. It did take time, but everyone came together. We were having to ask them to make difficult decisions on a phone call.
Mhm.
Counties were on lockdown in April and May. Kids of parents who were sick were not able to travel because of the lockdown. There were no flights going anywhere. There were rules for each county in itself. They were not able to travel within state by road.
Mhm.
And at that point, you were there with the patient. You were their family, and
Right.
you were making the decision. You're probably the last voice they were going to hear. You're the person you were going to talk to. And to have that conversation in front of an iPad when the family is so far away, it's difficult because we deal with a huge volume of patients and we make these decisions multiple times a day to realize the fact that it's a life-changing event for somebody,
Yes.
Right.
somebody's spouse, it's somebody, but the way the community has been understanding, and I want to take this opportunity to thank them for allowing us to be that one to be with their special one. And without their cooperation, their support, their patience waiting for our phone calls till 6:30 and 7:30 in the evening while we're dealing with everything at the hospital, being patient, trying not to call us, to hold that back, that urge back. They've done an excellent job, and we're proud to be serving you all. But please do stay safe. That's a message I do want to send out to all of you. Just stay safe, and we're with you because you're with us.
So, Josh, I think you mentioned this at one point earlier. You actually take classes in how to have difficult conversations with with family members, and I guess this is. I don't know if were you able to have the requisite number of classes in that, because I know this is the number of tough conversations y'all have been able to have had to have in these recent months. I don't think you probably would have that many in a normal career. Can you also talk more about that? What that's been like and what it's taught you?
It's like we were pushed into a swimming pool without knowing how to swim. And then we had to start swimming.
I'm just going to interject you right there, Pat. No, it doesn't matter how many classes or simulations we have in end of life conversation. It's never going to be enough, and every case is different, and every time is just as hard.
Right.
It's not easy to tell a relative that the loved one is dying, and that in the eyes of science, there's nothing else to do.
Mm-hmm.
Right.
And I think we talked about this yesterday. I love to be wrong in that sense. Yeah. I love that things make a turn for the better, and that we have patients that actually survive when we thought that they were not going to do it. But having that conversation, it hurts us. It's painful, but somebody has to do it. But what we try to do is just to be honest and describe what we see, and just be very sympathetic. Like I said, well, you said in the beginning, I'm originally from Colombia, and Hispanic families, we tend to pray and hope for miracles. So having a Hispanic family understand that there's nothing that science can do anymore, it takes time. So having those conversations, it's very hard. So, right, Josh, how many end of life simulations could we possibly have to make that?
Frankly, I feel like the conversations we have in real time, like Claudia said, I mean, we can't, these are not, they're very difficult to have. I think when we have to sit down, we have to slow things down for ourselves, and we have to be very forthright. And the people here and all of our, co-residents, that's what we try and do. Because what we know is medicine, when I talk to the patients and when I talk to the families, I had several of those conversations in the past few weeks, Pat, in the Midland ICU. And we don't, like I said, we don't know their loved one like they know their loved one. We have the pleasure of treating their loved one and giving them our all. But when it comes down to it, when I'm telling a family what the prognosis is, I have to be very forthright and honest. At this point in time, I mean, our attending physicians whom expertise is in ICU medicine have seen countless number of critically ill patients even before this started. And we started to see just what happens with severe COVID-19 disease. I just tell the families, this is what we can expect. We can apply a lot of the principles that we originally learned from ICU before COVID. But in a lot of ways, there are conversations that we have with these families, and we have to be very straightforward and honest. And that's the only way we know how to be, because that's what we're there for. We're there to provide the medical aspect. But again, we have to sort of stop ourselves and be like, okay, beyond the medicine, this is a family that is going through something that we cannot feel. And we need to stop and feel what they're feeling for a moment, because that is where our rapport lasts, because they will remember our face. And we want them to know that we're doing everything that we can for their loved one, no matter what. And when it comes down to it, we sit down with our attending physicians and with the family members, and we have the conversations regarding, what foreshadowing we can offer as far as the patient's ICU course. So those conversations haven't gotten any easier. And frankly, the courses, once we got past those courses, we stopped having them because we couldn't do them because of COVID, Pat. So a lot of our learning has been just the purpose of residency in terms of the experiences on the fly, trial by fire, being pushed in the swimming pool without floaties, sort of thing. Yeah.
But the amazing thing too is the whole nature of this pandemic has been very separating. You can't have contact with so many people. It is put this barrier between you and your patients and you and the families and stuff. But yet it's also enabled y'all to hone your ability to be more human, I guess. And it's allowed you to inject your humanity more in a way that, you may not have been able to do had you not been thrust into this crazy situation.
I think that's a great way to describe it, Pat. I think that we're replacing the humanity that COVID has tried to remove from the healthcare setting. That's what we're trying to do.
I think we'll have to just be very creative. For those that know me here, and for those that are watching, everybody knows that I'm very affectionate. So when you're affectionate and a hugger like I am, this has been the biggest punishment.
You can't hug anyone.
I mean, for a year, I haven't been able to hug people.
Claudia's in exile.
So you asked about how much this has changed us physically or mentally. About myself, I have found strength that I didn't think that I had, physical strength. I mean, the ability to go 24 hours, 30 hours, nonstop, eyes open, all wired up in the hospital setting, and just be there because you need to be there. You can't be. I think that physical strength and the Starbucks and chocolate have helped. And the other thing that I have learned about myself is to channel that affection, the compassion. If I can physically hug, I am going to let you know that I care for you. And I think this is what we all are achieving beyond the masks, beyond the shields. It's just the ability to smile with our eyes, the ability to make everybody feel through the phone when we talk to our loved ones or to the relatives or the loved patients that are in the hospital. This is what we're doing, and you can't give up. And this is what we're doing. So I think everybody has been finding creative ways to express that love that we have been retaining, that we cannot physically express or touch or feel, because we have to be careful. And I have to, we have to protect each other and our families.
Right.
So I have learned to physically distance myself from people, and but I've been very successful. But definitely, it makes me feel better now that I'm vaccinated. And I said that I was going to recommend everybody to get vaccinated as many times as I had the chance to say it. And then two, I would recommend, please wear your masks. Please wear your masks in public. And I think it will protect everybody around you, the community. And if we can get less cases in the hospital, that can also make everybody else's life, as far as healthcare personnel, easier. We don't want to see full, you know how depressing it is to walk now these days in the hospital with these hallways, all closed doors, just gowns at the doors. It just looks deserted. It looks like a ghost town.
Mm-hmm.
And that's all we see.
Yes.
So please just wear your masks and vaccinate.
On a lighter note, Pat, when Josh and I were working together in April, that was when the face shield concept came out. So Josh was like, Nea, what do you think about social cues anymore? Do you think people are even going to go by them? I can look at your eyes and tell you I hate you, or like, but no one's going to know.
As they say, smile with your eyes. That's all you can do.
But that's the one thing I've noticed about y'all is the one thing that's come out, knowing y'all, is that y'all absolutely hate having to mask and not being able to see each other's faces. And you could tell y'all do not like it at all. Well, no one does, but
it's like it's like an episode of Cheers, Pat. Remember Cheers?
Yeah.
You want to walk into the bar and you want to see all your faces. You want to laugh. When we get in the hospital in the morning, we're walking through the ICU. It's like, before we get started with our day, seeing familiar faces is like, hey, good morning. Like, hey, I want to have lunch with you later, But it's like, when you're sort of staring, it's like, wait a second, who is that? I know that. Is that Myra? Yeah, that's Myra. So I think day or night, we try and still, we keep ourselves upbeat. We still try and do the things that we enjoy outside the hospital. I think it's really important from a wellness standpoint. Spend time with our family, spend time with friends, FaceTime family that's not home,
Yes.
not in our homes. My extended family's in California. Shout out to them and all the other families watching of all of us here. But I think that's a big way that we try and keep ourselves level. Try and keep ourselves, pre-pandemic vibrations and feelings regarding just finding solace outside of COVID-19 pandemic.
Right. Myra, what about you? What have you kind of learned about yourself through all this?
I think I'm more resilient than I ever thought I was, honestly. And then, being a senior resident, you not only have to do your own work when you're on the floor, and we've been dealing with, the COVID floor since the beginning of the pandemic. And we've done this rotation multiple times, have been asked to back up our service multiple times. And, overseeing what our interns were doing, because they were very new when they came in. Our interns came into the pandemic this year. So we had to kind of train them how, to deal with the pandemic, different aspects about it. So which was a challenge in itself, I think. And then as, late second years, early third years, since we were the seniors who were thrown into this, we dealt with a large portion of the clinic population, hospital follow-ups for our COVID patients who were discharged from the hospital, seeing them in different, even nursing home settings. So we've seen literally with family medicine, the thing is we see them in the ER, starting from the outpatient, ER, the hospital floor, ICU we also do. We then see them in the nursing home also. We've been doing telemedicine for our nursing home patients for COVID also. And then, so we've seen them literally in every setting possible. Some of our peds residents who are doing peds have seen peds cases as well for family medicine. So we've seen it all. And I think for our interns, it's been a challenge trying to adapt to this. And thankfully, we were kind of trained for it to be able to train them how to deal with all of this. And I think they're doing a good job, honestly.
I will also like to add that, just, with the whole residency program, residency is all about learning, training with each other. You have all these experiences that you share with each other. COVID has completely flipped that upside down. As Myra was just mentioning, our interns don't have that experience. All they know is COVID, to be honest.
Right.
They don't know about all of our chronic medical issues that we saw on a day-to-day basis. And which is our core, which is core part of our learning education from a clinical standpoint. And so that's kind of lost. I've learned that as a third year, yes, we've been able to adapt, but I can also hope that first and second year residents can also get that experience to adapt and also kind of change the program, because COVID is going to be around. Unfortunately, it's not going away.
Right.
I don't think there will be a normal for a very long time, unfortunately, as much hope as we have. So they're going to have to learn how to adapt to that as well. And I think it's our job to kind of teach them, as residents, the senior residents teach the younger residents, and that's how it goes. And, so I think it's important that they also learn that going forward.
So go ahead, Josh.
Give them a shout out, Pat, to all the interns, because honestly, all of them that I've had the pleasure of coming in contact with in the hospital, they put their head down. They've been working hard.
Yes.
And they walked into ICUs full of patients. And honestly, if they're listening out there, all your senior residents are trying to do our best to still do what we can to train you and do all the other stuff beyond the COVID stuff to get you ready. So hopefully they know that. But a lot of props to all the PGY ones, family medicine, internal medicine, even OBGYN and psychiatry. They're all dealing with COVID in their own way. So.
Yeah, it's a spectrum. Like we've seen COVID encephalopathy also on our hospital floors and in the ICU. We've seen GI complaints going, so bad with COVID. We've seen, of course, the respiratory cardiovascular is the primary, part of it, but it's a spectrum of disease, honestly. And then once it gets out of control, then, it is difficult to manage, and it's been challenging for sure.
And at the end of the spectrum, like Mara said, everything can go haywire, but when you see that patient, weaning them off of oxygen, sending them home, knowing that you're going to get them back, see them back in the clinic for a follow-up, it's healing in its own way.
Yes.
We've got the privilege of doing that. Unfortunately, because of the census going up high, internal medicine was able to pitch in to take care of these patients on the floors, and their spirits and the way they respond, and they're willing to work with you. And that's something which makes us wake up every day morning again and get ready for all of this.
Exactly. Yes.
Do you think, I mean, it's clear that y'all love what you do, that you have a passion for it. Do you think that you would have this level of love for it had you not have had to go through such a trying time? I mean, your eyes kind of lit up now when you talked about, when you weaning someone off of oxygen, it's kind of like, I felt like asking you, was that the feeling you were looking for when you said, I want to be a doctor? Do you think that this has heightened your...
The pandemic itself, whenever we see that in a patient, whenever we see that our patient's eating food and our patient's able to walk around in the room, and when we tell them, you're going to go home today, and they're like, really? Can I call my wife? Or can I call my... Go for it. I'm going to stay right here and watch you do it. I think...
Even before the pandemic, every patient getting better, back on their feet, back to their baseline is a success, and that makes your day. And it was even before that was, the prime of would be the prime of our day every time. Yes.
And you know what, Pat, like we all develop a strong relationship, not only with our patients, but also with their relatives. And like Myra said, even before COVID, this is because we love what we do. I mean, it's like with passion. It's just like special. It makes our day. I wouldn't be doing anything different, I think you develop a relationship. We've talked to people that I have never seen in my life. And then one day you see them and it's like you've known them forever, like, relatives or people that we just call over the phone for a month and told them what was going on in the hospital. And then they see you and you know everything about each other. And it's not just about the success. It is not about the, of course, it makes us very happy of those cases that do well. And now it's not just COVID, you know, in general, but also you develop a relationship with the people that don't do so well. But that's exactly what we're there for. It's a healing. We're a healing hand. We're just extending our services to help people, to comfort them, to tell them that they're not alone in the process. In whichever way the process goes, we're all going to be there. We're going to be there. Our attendings, our teachers are going to be there. And wherever we go, just because we love this so much, I don't see myself doing anything different in my life. Yes. And this is what fills my heart with joy, with enthusiasm, with motivation. And it's a way for me to also tell my children, you need to help others, whichever way you find in your life. I found it through medicine. Maybe they're going to find it through other things in life. But right now, everybody that is listening to, everybody has a role to play. Yes. And just simple actions that you can show compassion and love for others. Take care of each other. That's all you need. And just do it with love every day of your life, and you're going to be happy.
Yes.
I think it's a good opportunity while we're talking about how this time has made us feel to also give props to the people who make it a pleasure to work where we work.
Right.
A lot of the core staff in Midland Memorial Hospital floor and ICU, whom I just work with, as well as the medical center hospital ICU and floor staff, even the FEMA nursing staff. I'm giving a shout out to the respiratory therapists as well. Honestly, they made it a pleasure to work during such a difficult time. Exactly. We work all together. We don't function by ourselves, and they're a huge part of that. So we love you. Just want to send that message out.
Like we go from, oh, the resident, the eyeball roll, to being like, oh, we're so proud you're going to graduate and you're going to go. We're really proud of you. So we go through all the phases with them, and they've stuck by us.
You are their children.
Absolutely.
Well, and it doesn't go unnoticed. Just a couple of quick little texts we got. Dr. Naidu basically said, you're all going to make fantastic doctors with your healing hands and assuring pat on the back for patients. And then there's Kristen Rodriguez Levadio from the Health Sciences Center. She said, proud to have all of you on our Texas Tech Health Science Center team. Thank you for your hard work. You are our hashtag healthcare heroes. So don't think that it doesn't go unnoticed. You know, it's getting where we have to wrap things up. And I think what I'd like to do is just kind of go around and kind of get some final thoughts from each of you on what this has all meant to you and kind of where you hope to go from here. So starting with you, Mara.
So I think this has been such an interesting and challenging time for all of us. Every day the evidence is changing. There's, you know, we cannot even keep up with the amount of evidence that's coming every single day. So just that being a clinical, you know, a researcher and everything, that has been a very challenging, interesting time for me. And I think I will, you know, try to inculcate more of, you know, evidence going forward in my practice as well, because of course all of this matters, and COVID will be a part of our lives going forward for years. We can already see that. But yes, it's taught me more compassion. It's taught me more about myself, being, you know, stronger than I thought I was ever. And then how to be, honestly, on a personal level, I think I've become a better parent also. I've understood the value of family more than ever before. Because of this pandemic. So yes, I think it's taught me so many things on so many levels. So I'm in a way grateful for it too, in a way.
Super good. Chirag.
I will say that this has been a challenging but humbling time as well. You know, I've learned a lot about, you know, my abilities and abilities to lead, especially, you know, during a pandemic. I would have never guessed that I'd have that opportunity going into, you know, 2020. And so, in a way, as like Myra said, it's been a challenge, but also a blessing in a way, because you learn on what you've through experience, and that's what residency is about. It's through experience. So I'm glad to have had this opportunity, but you know, I want to make sure that, you know, we're continuing to treat our patients and not just looking at them acutely, you know, just treating them with COVID, but hopefully building on COVID and then still learning on all of our chronic issues, which is very important. And that's just another reminder I'd like to, put to the community that, our health is our most important, endearing thing to us. Without it, there's nothing else that's more important than that. And we need to continue that. And as physicians, I'm glad that we're leading the charge on helping care of the West Texas community, and hope to do that, going forward.
Thank you. Neha.
Like I said, COVID personally weaved into my personal life midway when I just thought that there's nothing new that can happen.
Yeah.
So it again, like Myra said, it made me very resilient, and it also made me tell myself that if I can get through this, then I can get through anything. So for the years to come, this is going to be the motivation with which I wake up every day. And that's how I want to practice my career. And again, I've realized how fragile and important relationships are with families, not only of my own, but with patients, with the community. And I think one message to the community is continue masking, stay safe, stay safe. Your health is your asset, and losing health is the biggest loss in life. So stay safe, keep it really tight, hold it close to your heart.
Thank you, Neha. What about you, Claudia?
I would say that I feel very fortunate for everybody that I love to be in good health, despite that in some way or some fashion, this pandemic has touched everybody's lives. All of us have had something that has happened to our families in some way. I feel very fortunate to learn from it. I would share some words of wisdom from one of my attendings from the ICU, in which he said, we need to learn to respect this virus. And I would add, just fear it a little bit, more than you do. This is not yet the time to lower your guard and go out to the mall and not wear your mask, and we're not there yet. So just think about this virus as for those that watch The Walking Dead, something like that, something that really is going to eat you up and kill you. This could be like that. So just fear the virus, respect the virus, mask up, and get your vaccine whenever possible. I have to thank my school. Texas Tech has been an incredible place to train. And I could not have imagined doing what I'm doing right now with the training I have received. Without the training I have received, it's incredible, because like one day you're an intern and you're following your seniors, and the next day you're a senior and you're supposed to know it all and do everything. And it's just like, you wake up as, you go to sleep as an intern, you wake up as a senior, and boom, you have to do it all. But yes, we've been doing it, and we've been doing it well. So, and it's thanks to our attendings, our seniors, and the training we have received. So that's fantastic. Thank you to our GME office, to our programs for watching us, taking care of us, feeding us, sending us reinforcements when we have had to our families, for putting up with all these different variations of new reality that we have brought to them. I think, and definitely just thanks to all our families. I'm going to say one line in Spanish to our Spanish speaker, if you will allow me.
Sure.
Muchas gracias a todas las personas que nos están observando hoy y por acompañarnos esta noche. Y no se les olvide ponerse su máscara y hacerse vacunar cuando lo puedan hacer. Es muy importante.
Eso.
And just thank you for this opportunity.
Thank you. And last but not least, the ringleader, Josh. What can you leave us with?
I think everybody has echoed a lot of things that I would otherwise say, but I think in a lot of ways, this particular evening, having the opportunity to share with a community like this, where it's live and recorded, people can watch us afterwards. In a lot of ways, it's going to be a time capsule for us. In terms of where we are, where we've been in the pandemic, where we are now, and where we're going to be. I think we talked about, what it's going to be like. We're going to sit down, 10, 20 years from now, wherever we are in the pandemic, whether it's an afterthought or if it's something still going on or what, but we'll be able to sit down. I hope we'll still be able to have a conversation like this, Pat. And maybe you'll be able to join us too.
Absolutely.
and we'll be able to, reconcile everything that happened, but also take away everything that we've learned and appreciate whoever we work with, the families whom supported us and continue to be there for us no matter what. So really, thank you for being here and taking the opportunity to speak with us too, Pat. Appreciate it.
Absolutely. I can't thank y'all enough. Y'all are a really special bunch. And I guess what I'd have to say is, each of you is either from someplace else or is probably headed someplace else when your stint's over here. But it's wonderful to know that your time here, you've loved this place like home, and you've loved this community and its members and treated us like family. And your compassion and love is so obvious. And the fact that you're so engaged in this community really is. You may wound up somewhere else down the road, but this will always be your home and will always be family. So stay safe, and thank you so much. And with that, I'm going to turn it over to Ravi.
Thank you, Pat, and Dr. Ronan, and Dr. Ahmed, Dr. Kelso, Dr. Panchangula, and Dr. Alu. All of you represent the best, and Texas Tech Family Practice International has to offer. And it reminds us the invaluable institution we have in Odessa and Midland and the services that you have been providing. So everybody has been acknowledged that you will be fantastic physicians wherever you go. But for the time you are here, as Pat said, we appreciate all of you for your dedication, compassion, and your effort without holding anything back. So thank you all for taking part in this discussion. Thank you very much.
Sir, thank you for having us.
Thank you for having us.
And Pat, sir, I can't say enough of your contribution to this discussion.
Sure.
You bring the human touch and the normal touch, and also you sacrifice. Today is your birthday, and you are here.
Well, when you have the gift for gab like I do, it's hard to pass up things like these.
So we wish you a very happy birthday and
you.
many happy returns, sir. Thank you for everything what you do for us and for the community.
Thank you.
And just a note for all the watching the community, this is the last of the COVID series. So we have made an attempt to bring the clinicians to discuss their thoughts and experiences directly with the community. We're going to take a break next week, but starting after that, COVID has brought an attention to the chronic diseases, diabetes, obesity, hypertension, which always we took it for granted. The community at large, not the physicians know better. But we would like to address that and appreciate Pat offering to continue to support that initiative along with Odessa American. And so we would like to go for discussing that for pediatrics, adults, and seniors. So that way we get into a public education and public health model. So looking forward to that and wish you all, the panel members today, continued success and safe journey through all this COVID experience. Thank you very much.
Thank you very much. Good luck, everyone. Stay in touch.
Bye-bye.
Take care. Bye-bye.